Welcome back to another Research Connection. Today I am here with Dr. Kelley Varner. She's an assistant professor in our Department of Molecular Biomedical Sciences. She's an anesthesiologist who focuses on large animal medicine. When a lot of people think about anesthesiology, they think of just sedation for surgery or other medical procedures, but there's a really big component to anesthesiology looking at welfare and pain management in animals. Can you tell us some of the research that's going on in that component of anesthesiology?
Veterinarians all believe in the basic 5 tenets of animal welfare. And these 5 tenets basically tell us that animals that are under human care should be free from hunger and thirst, free from disease and injury, free from pain, fear, and distress, free from the freedom to express normal behaviors, a variety of different things that we all agree as a whole we should be working really hard to accomplish, right? Mm-hmm. And I think all of us can agree making a happy cow who is not frightened and not sick to produce food for our food chain in the United States, it's a very admirable goal for us all to have. Mm-hmm. And up until this point, it has been a little bit less of an issue in terms of food animal medicine being behind the times of small animal medicine. So in small animal, we think about analgesia or pain management as being very important, right? Mm-hmm. Dogs live in your house, they sleep in your bed, you know when they're uncomfortable and when they're unhappy. This cow, however, is a prey animal, and she doesn't want to show us predators, ours on the front of our head, right? That she is uncomfortable or painful or something is not right. So we have to develop some techniques to try and decide when an animal needs more pain management, and also new techniques to provide to create analgesia in these patients to help improve their welfare overall as they provide a very important service to our country.
So you touched on how your research focuses on large animals in particular, cows. I saw a study on donkeys, which is really cool. How is the approach to research and even the research needs in these large animals different than small animals in anesthesiology?
Yeah, so that's a great question. So I think the first most important big difference is a difference in goals. So small animal medicine has a little bit of a different goal than large animal medicine has. So in small animal medicine, we typically think about doing individualized patient care. We take one dog, we work on that one dog, we do exactly what that one dog needs, and then they go. Mm-hmm. When we talk about cows and sheep and goats and all of these food-producing species, we're talking about animals that live in groups of 50, 100, several hundred, maybe even in the thousands. So it becomes harder to address individual animals, and so we do a lot more work on herd health or the health of the entire group of animals. As an anesthesiologist, however, I still get to focus on the individual animal, even if they are a food animal. So one of the biggest differences is that it is much harder and much more dangerous to anesthetize an animal that weighs 1,500 or 2,000 pounds than it is to anesthetize our 5-pound Chihuahua friends, right?
Yeah.
And it's not just dangerous for the human beings involved to work around an unconscious 2,000-pound animal, it's also just dangerous for the animals. They're not designed to be anesthetized. And so for that reason, we actually do a lot of awake surgery in large animal medicine. And so we say over behind the times a little bit, but actually food animal practitioners are the ones who pioneered the idea of awake surgery under local regional anesthesia, which is now something they do in human medicine. So actually our bovine veterinarians get some credit in that they invented this thing, right? But we can make it better for them. And that's what I'm working on, how to make it easier for them to create anesthesia to a certain area of the body so that they can do surgery while the animal remains conscious, so that the animal doesn't have to be exposed to an event that, one, is not only expensive and might limit their ability to receive care, but two, that is also dangerous for them and the people involved. And so our work focuses a lot on how to improve those techniques available to practitioners to create that anesthesia, how to use different combinations of anesthetic drugs to create more profound pain management, more profound anesthesia that lasts for longer to create healthier, happier cows, and also ways to implement and determine whether or not your pain protocol or analgesic protocol is actually effective in these animals. Because that's the other piece of all of this, is that we're still working to understand, do they respond to all the drugs we use in other species the same way? And should we be using the same doses? So that is a lot of what our work is focused on right now.
Anesthesiology and pharmacology in general, I think, play a bigger role in food animal production than people realize. Can you talk about the kind of link between animal and human health through our livestock and large animals?
Yeah, so I think human and animal health intersect in a number of places in food animal medicine. So probably the most well-known area is antibiotics and antimicrobial resistance, right? That is probably the largest area where we have cross intersections between animal and human health when it relates to food animals. That's somebody else's job. That's the ruminant veterinarians love to do that. So I focus mostly on the anesthesia side and practitioner safety side of things. And so the federal government spends a lot of money every year trying to convince veterinarians to work in rural areas of the country where there are high populations of food animals with low populations of people and veterinarians. And they struggle to fill those positions, which means that there are areas in our country where it could be several hours before a veterinarian could get to you to care for one of your animals. And so then, based on that, it becomes very important for us to protect those people, right? To make sure that they are safe, that they can continue to do that job long term. And we already talked a little bit about how dangerous it is to work with animals who weigh as much as these animals do. And it's not that dairy cows are mean and that they're trying to get you. It's just that their plain size is so big. And then when we talk about doing surgery to them awake, well, if you don't get the anesthesia right, they're going to be very resentful of what is happening. And that can be very dangerous to the veterinarian. So I really want to make sure those people are safe. They're doing something very good for our country. It is really hard for us to get veterinarians to work in those situations. And so I asked myself, how can I make that better for them? Well, the thing I can do right now is help it so that they can do standing surgery safer and more easily, and that it's also easier and safer for the animal. And so that is the vast majority of the work I'm doing right now, is looking at local anesthetic techniques and new approaches to creating local anesthesia in these animals as a means to help protect the veterinarians as well as the animals.